Hi, my name is Dr. Walter Crooks, and I'm here today to talk to you about what makes us unique. First off, I'm a chiropractic clinical neurologist. See, just like in medicine, there are specialties in chiropractic. My specialty is neurology. So what makes us different here is that we look at you in three different ways at your system. First way we're going to look at you, we're going to look at you structurally. We want to see how you look structurally. Now in your spine, we'll start there. Looking at you from the front, you should be straight. When we look at you from the side, you should have three curves in your spine. You should have a curve that goes forward here, it's lordotic. Then you should have a curve in your upper part of your back that goes back, kyphotic. And then you have a lower back curve, lordotic again. Three curves. We want to make sure those curves are there, because that kind of shows us what's going on in your brain if we start to lose those curves. They can put pressure on your nerves to go out to your arms and your hands and your feet and cause you all kind of problems, tingling, burning, and all those things. Next, what we want to do is we want to look at you neurologically. We want to see if you have any nerve damage, if you have any pain, burning, any tingling, numbness. We want to find out what's going on and why do you have those things. Okay? Third way we're going to look at you is going to be metabolically. We want to see how well the body's functioning. Okay, we want to see how well your body's functioning, how well your immune system's functioning. We want to see how your blood sugar is. See, optimal ranges for blood sugar are 85 to 99. We want to make sure you fall within those ranges. We want to check your hemoglobin A1C. Hemoglobin A1C should be below 5.9. We also want to check to see if you're anemic. Because if you're anemic, that means basically you're not getting any oxygen to your cells. Without oxygen, how can you ever be well? If your cells can't get the fuel they need, they can never be working optimally. We want to check to see if you have any inflammation in your body, because inflammation wreaks havoc upon yourself. See, we do blood tests for all this. We do a 59-panel blood test to test 59 different health markers in your blood. We want to check for food protein reactions. You see, if you're having reactions to food that you eat, you become inflamed all over. And we do not want that to happen. We want to find out if that's what's causing your problem, if that's what's initiating all these problems you're having. See, food protein initiation can cause all kinds of things. It can initiate, well, when you have a reaction to it, can initiate even autoimmune diseases. What makes us unique here at Life-Changing Care Neurology Center is we look at these three different ways of looking at you. We look at you neurologically, we look at you metabolically, and we look at you structurally. We want to make sure that all these systems are working correctly to give you the optimal chance at life. You see, when you go to most doctors and they run your blood test, they just want to make sure that you're within the normal range. Well, let me tell you how normal works. What they do is they take everybody that goes to that particular lab, they take out the really high numbers, they take out the really low numbers, and what's left in the middle, that's what they call normal. It's just a bell curve analysis. Well, we don't do that here. We use what's called functional blood chemistry numbers. We use numbers that are way tighter, ranges that are closer, because we want to find out we want to have you in the optimal range. Now, you could go and be normal if that's what you want to be, but normal is just like sick like everybody else. I suggest that you be optimal, because optimal function equals optimal health. Thank you for spending these last few minutes with me. I really enjoyed talking to you. Thanks.